Hi, I'm Sam. Today we are going to learn how to use the single-use insulin pen needle, a convenient medical device used for injecting insulin. The single-use insulin pen needle consists of 4 parts: the outer cap, the inner cap, the needle, and the paper seal. Take a 5 mm 31 gauge pen needle for a regular waist and 4 mm 32 gauge pen needle for a slim waist. First, carefully remove the paper seal from the new pen needle. Then wipe the rubber seal of the end of the pen cartridge holder with Dispocan alcohol swab. Push the pen needle straight onto the pen and twist until it is tightly attached. Pull off the outer protective cap and set it aside. You will need it later to remove the needle from the pen safely. Remove the inner protective cap and throw it away. Be careful not to bend the needle. Adjust the required dose in the insulin pen. The preferred sites to administer insulin injection are abdomen, upper outer arms, buttocks, and upper outer thighs. Now push the needle all the way into the skin and inject the insulin. Wait for few seconds before removing needle to enable insulin to disperse. After injecting the insulin, carefully put the outer protective cap onto the pen and remove the used pen needle. Immediately dispose of the insulin pen needle in a sharps container for medical waste. Always remember, single-use pen needles are for single use only. They should be disposed of safely after each use, as reusing them can lead to painful insertion, increase the risk of lipohypertrophy or lumpy skin, and infected needles. The single-use pen needles are available in a pouch pack of 5 pieces for individual use and a box pack of 100 pieces for hospital and institutional use. To know more about HMD Healthcare, visit HMD Healthcare at hmdhealthcare.com.